Hi, my name is Andrea Leonard. I'm a 33-year cancer survivor and president and founder of the Cancer Exercise Training Institute. My cancer journey began in 1981 when my mom was first diagnosed with breast cancer. And in the aftermath of her surgery and treatment, I saw so many debilitating side effects that could have been prevented. I began to do research, which took 3 years, working with the chiefs of breast surgery at Georgetown, GW, and Johns Hopkins, and wrote one of the first books that was ever written on exercise recovery for breast cancer survivors. Through the years, I've developed coursework to help fitness professionals be competent and qualified to work with cancer patients through the recovery process. The book that you're about to read or that you're reading alongside watching these videos is always going to be there for you as a resource. Don't try to memorize it. Learn how to resource information in the book. Figure out what applies to you as a fitness professional. Don't worry about memorizing definitions, but think about what does this side effect, what does this muscle imbalance have to do with the exercise programming, and how can I help to correct that? You will see the videos to follow that will go along with the handbook and show you how to do the proper form of the exercises on the BOSU Balance Trainer. Read through the book. You'll see a red stop sign with a hand, which will show you how to progress, how to regress sometimes, when to move on to the next exercise, and what exactly should be part of your recovery program. This is the exercise programming portion of the Breast Cancer Recovery BOSU Specialist Advanced Qualification. It's very important that you remember that you always do a warm-up prior to beginning any exercises. It can be riding an exercise bike, going for a walk, or in the best case scenario, they are actually going to be bouncing on the BOSU Balance Trainer. The beauty of that is that it simulates the same movement as bouncing on a mini tramp, and there have been many studies showing that that helps with the flow of lymph and lymphatic fluid. This will help us to help our client encourage lymphatic flow and prevent or minimize lymphedema. Every exercise that you see in your handbook is going to have a level 1, level 2, and sometimes level 3. And it's very important that you progress gradually, so make sure that they can do level 1 with no pain, no problems. When they can, then they can move on to level 2, so on and so forth. And there's going to be progression and sometimes regression. You may move on to level 2 and realize that they're not quite ready for that yet. So go back to level 1, do that for a while, and then they can always come back to level 2 at another time. So we're going to start all of our exercise sessions off with at least a 5-minute warm-up. You want to make sure that your client can tolerate even that 5 minutes. So try and determine what that intensity level is. We know what the duration is going to be, but they can change their effort of exertion. So we're going to start off by having them step onto the BOSU Balance Trainer. Now, if you look at your book in level 1, you'll notice that you are going to be spotting them. And then they can even do it on the floor to begin with, just marching in place. But level 2, they can get on the BOSU Balance Trainer on their own, holding on to something, maybe a chair back or even a dowel for balance. But we want to make sure that they are not going to injure themselves. If somebody has peripheral neuropathy and they have burning, tingling, numbness, pain in their feet, we do not want them standing on the BOSU Balance Trainer, as they don't have the sensation, and it is a high risk for falling and then, of course, injury. Or if there are any other reasons that they should not be on here. If they have bone metastasis, fractures, anything that has an increased risk if they fall. So to begin with, we're just going to have them shift their weight. Nice and easy, engage their core, drawing in their belly button to the spine. Tell them to bring their shoulders back, keep their head in alignment, and they're not jumping up and down on the balance trainer. It's literally just shifting the weight. And even for somebody who considers themselves fairly fit, this is challenging. So don't be surprised if your client has to have something to hold on to begin with. So 5 minutes, start your warm-up, Make sure that they have no problems with that. And then the next exercise session, you can increase it to 6 and to 7, so on and so forth. But don't take huge leaps in time. You don't want to go from 5 minutes to 10 minutes to 15 minutes, because at any point that might be too much for the lymphatic system to handle, and they may end up with lymphedema. At that point, we don't know if they would have been fine with only 6 minutes or 7 minutes, because we jumped all the way to 10. So start and progress slowly. We're going to begin with exercises to correct muscle imbalances that are the result of surgery and or treatment, and we will progress from there.